Okay. Everybody still awake with me? Sort of awake, sort of with me, sort of with me, sort of awake. Let's get into the Glasgow Outcome Scale at this point now. So basically there are 5 levels of functional recovery that are defined by the Glasgow Outcome Scale, defined or categorized by. So obviously the first level, we don't have to do an awful lot of functional assessment in that particular classification. Anyone who wants to argue with me, I'm glad to hear your argument. Number 2 is also one that's pretty easy to, even a layperson can probably get that one right. So the main issues are between doing more or less a differential diagnosis, differential function analysis between levels 3 and 4. So the severe disability, one of the earlier kind of catchphrases was those who are often dependent, oftentimes institutionalized, versus moderate disability, disabled but independent. And level 5, typically we do a comprehensive assessment for everybody, but obviously these are the ones that are very, very straightforward, the good recovery folks. They don't necessarily have to be working for it. Okay. So let me focus now on, again, this idea, this distinction between level 3, severe disability, and level 4. So the actual definition that is used in the original Glasgow Outcome Scale is that severe disability is used to describe patients who are dependent for daily support by reason of mental or physical disability, usually a combination of both. Many will be in institutions. Severe mental disability may occasionally justify this classification in a patient with little or no physical disability. And that's referenced by the original neurosurgical authors, Jeanette and Bond. The Glasgow Outcome Scale was meant to be kind of the opposite end relative to GCS, in the sense it was supposed to be able to give a sense in terms of when prognosticating the outcomes and looking at from research standpoint, looking at the outcomes of various kinds of neurosurgical techniques. So let me throw out a bit of a question here for you. So they need to be dependent for daily support by reason of mental or physical disability, usually a combination of both. So let's say you have somebody who has a traumatic brain injury, and they also have an orthopedic hip fracture. So would we consider both in addressing the Glasgow Outcome Scale? Would we consider the impact of both in doing this measurement? Yes? We in agreement? Anyone in disagreement? No dissenters? Oh my goodness. Rocco said you guys were a really sharp group. Not one person got it right. So don't forget, this is Glasgow Outcome Scale. It's a measure of the impact of brain impairment. So don't forget, brain impairments can be cognitive, they can be emotional, they can be physical. So what are some examples of physical manifestations of a traumatic brain injury?
Sleep disturbance, is that?
That's hard because it's hard to make a differential diagnosis. So think of something that's a little bit clearly physical.
Headaches?
Sorry?
Headaches?
Headaches, again, that's also, there are cervicogenic headaches, there are migraines, there are muscle tension headaches. So where's our neurologist?
Seizures.
Who's our, yes, sir.
Paralysis.
Thank you. Yes.
The gross motor.
Absolutely, that's right, good. So when we're talking about the physical, we're talking about the physical derived in the actual brain impairment. We're not talking about the orthopedic injury. We're not talking about the chronic pain that's an MSK, chronic derivative of MSK. Okay. So moderate disability, as defined in the original article, speaks to the notion that such patients can travel by public transport and can work in a sheltered environment and are therefore independent insofar as daily life is concerned. The disabilities found include varying degrees of dysphagia, hemiparesis, or ataxia, as well as intellectual and memory deficits and personality changes. Okay? So that gives you somewhat of a distinction between the two. And at the time that we were initially as a group of CAT DACs, and there were 7 CAT DACs across the province, and the Minister of Finance had established a CAT development committee, and then there were subgroups associated with the various criteria within CAT. So as mentioned earlier, I sat on the Glasgow Outcome Scale subgroup, and what we were looking for was we're looking for clinical protocols that would help us to assess the GOS. So we searched the worldwide literature. We in particular looked towards the US, as we oftentimes do. And we end up finding what was called basically like a revised Glasgow Outcome Scale by the same authors.